Good morning, and welcome to the Children's Campaign's webinar on seclusion and restraint in Florida. I'm going to start with an extreme example that hit media outlets this summer after video was released of a 2018 incident where an 8-year-old Florida boy with documented special needs was arrested in Key West after allegedly hitting a substitute. The incident occurred after the boy failed to follow multiple verbal directions to sit properly on a bench in the lunchroom. When the teacher walked over to him, he told her not to touch him, then allegedly punched her in the chest. According to his mother, the boy takes medicine for ADHD, oppositional defiant disorder, depression, and anxiety, and when he's having an episode, he becomes very sensitive to touch. The boy's disabilities were well documented with the school. After the incident, the substitute called the police. When they arrived, they attempted to place him in handcuffs, but they were too big for his hands. He was transported to jail from the school, fingerprinted, DNA swabbed, his mugshot taken, and charged with felony battery. It took 9 months, but finally the charges were dropped following a mental health evaluation. Like I said, this is an extreme example, but it illustrates what can happen when the response to what can be typical behavior in students with disabilities is not met with the training to redirect the issue away from turning into crisis, and the trauma students with disabilities can face when their behavior is met with an extreme and very negative response. Incidents like this example and the use of seclusion and restraint can lead to lifelong consequences for the child. Florida students with disabilities are facing practices and untrained staff that could cause them harm. Specifically, the use of seclusion and the overuse of restraint to address problem behaviors and dole out punishment, although these practices have not been proven to reduce problem behavior in any way. The Children's Campaign is going to recommend the following: end the harmful practice of seclusion and limit restraint on students in public schools. Specifically, ban all seclusion. Prohibit physical restraint for use as a behavior modification or punishment. Only allow physical restraint in instances of danger to the student or others. Ban all mechanical restraint or use of a device to hold a child immobile, and require training in positive behavior intervention for all staff and teachers involved in interaction with students with disabilities. And last, maintain accurate and transparent records on restraint and seclusion incidents. Seclusion and restraint is the practice of isolating children with disabilities and or holding them against their will. It is harmful and causes childhood trauma. These discipline practices are based in institutionalization, an out-of-date practice that ended because it was inhumane. Research-based best practices for positive behavior intervention and reduction or elimination of seclusion and restraint are available, and other states are using them, but Florida has repeatedly tried and failed to make the necessary change. We will discuss these topics in depth throughout the presentation. This webinar will be presented by the policy team of the Children's Campaign. The Children's Campaign is a nonprofit statewide child advocacy organization working to give children a voice in the legislative process. The policy team is comprised of myself, Amanda Ostrander, the Director of Policy for the campaign, and apprentices from Florida State University, who are juniors, seniors, and new graduates majoring in various concentrations, including political science, economics, education, and family and child science. So what is seclusion and restraint, and how does Florida use it? To start, we need to look to the definition, but Florida law does not define seclusion or restraint. Materials from the state's Department of Education refer us to the United States Department of Education Office of Civil Rights for the definition. Seclusion is the involuntary confinement of a student alone in a room or area from which the student is physically prevented from leaving. This does not include timeout, which is a behavior management tool and involves continuous monitoring of a student in a non-locked setting with the purpose being to calm the child. There are two versions of restraint: mechanical and physical. Mechanical is the use of any device or equipment to restrict a student's freedom of movement. This does not include devices that are prescribed by a medical professional to achieve proper body position or freedom of movement, or vehicle safety devices. Physical restraint is physical force that immobilizes or reduces the ability of a student to move his or her torso, arms, legs, or head freely. This does not include what they call physical escort, which is when hands are temporarily placed on a student to get them to move or walk to a safe location. Physical restraint can be seated or standing, or prone, which is lying face downward, or supine, which is lying face up. Currently, Florida law allows the use of seclusion and restraint on students with disabilities with some very minor restrictions. It prohibits the use of mechanical or physical restraint that restricts a student's breathing, and it prohibits school personnel from closing, locking, or physically blocking a student in a room if the room is unlit or does not meet the rules of the state fire marshal for seclusion and timeout rooms. Rules for these rooms are incredibly limited, but include a door that can always be open and specify the type of door lock allowed. The law also requires incident reports to be created and collected, and for data to be maintained on the number of incidents of seclusion and restraint. That data must include a detailed description of the incident, the name, age, grade, ethnicity, and disability of the student restrained or secluded, and a description of the type of restraint used. Also, it requires parents to be notified in a timely manner when restraint or seclusion is used on their child. So, what's the scope of the problem? Well, students with disabilities are massively overrepresented in seclusion and restraint statistics. Nationally, they make up 12% of the student population, but they make up 71% of all school restraints and 66% of seclusions. In Florida, students with disabilities make up 14.5% of the student population, which is around 414,000 students. But the state is one of 3 in the country whose students with disabilities make up over 90% of restraint incidents. Looking at the incidence of restraint and seclusion, we're going to use the 2017-18 school year data because it's the most recent available from the most reliable source. In 2017-2018, there were 8,367 incidences of restraint and 349 incidences of seclusion. As you can see from the graphs, over time, the number of seclusions has been decreasing, and that's since 2013, while the number of restraints vary. If we were to take the total over 5 years from 2013 to 2018, that's almost 42,000 incidences of restraint and around 8,000 incidences of seclusion. Looking closer at the school year data from 2017-2018 helps us identify who's most at risk. At the pie chart in the left-hand side, you can see that this is restraints by grade. 51.5% of all restraints were on children who are in pre-K through 3rd grade, or ages 4 through 8. If we add in our upper elementary and middle school students, they make up almost 90% of restraints in Florida, but only 70% of the total student population. If we look to the green pie chart, you can see the types of restraint that were used. 38% of restraint incidences that year were standing, and 31% were prone or lying face down. 2% of the restraint incidences, or about 167, were mechanical or used an instrument to immobilize a child. At the bottom, we look at seclusion by grade. 50% of seclusion incidences were on children 4th through 8th grade. That's ages 9 through 13. And if we add in, again, our youngest students, that pre-K through lower elementary, they make up 88% of seclusion incidences, which is, although again, they're only 70% of the student population. This shows us that our youngest students are most at risk of being placed under seclusion or restraint, and that if they are to be restrained, they will likely be standing or face down on the floor. Racial disparities exist in these numbers. The combination of systemic racial issues with increased number of behavior modification practices experienced by children with disabilities place children of color with disabilities at a high risk of seclusion and restraint. Nationally, Black students make up 19% of students with disabilities, but 36% of students who are mechanically restrained. And more than 1 out of 4 boys of color with disabilities and nearly 1 in 5 girls of color with disabilities will receive an out-of-school suspension while at school. In Florida specifically, Black students make up 21.6% of Florida's public school enrollment, but 43% of students who are secluded, 33% of students who are mechanically restrained, and 32% of students who are physically restrained. Children of color with disabilities are overrepresented, which illustrates that they are the most vulnerable to experiencing the trauma associated with seclusion and restraint. So, why did we look at the 2017-2018 data? Well, in short, Florida has a seclusion and restraint reporting problem. There are two systems where the numbers need to be reported. One is our BESS, Bureau of Exceptional Student Services system. That's very specific to our students with disabilities. And the other is the SIS, which is the Student Information System. That's for all students, and it's to follow discipline in public schools for the entire student population. Incidences are supposed to be reported in both, but the numbers do not align, with the SIS having many less incidences in their system, specifically those that include students with disabilities. Yet, these tend to be the numbers that are used to report the scope of the problem to the federal government and often the public. An example, the number of restraint incidences in 2013-14 recorded in the BESS system is 8,964, while the number reported to the federal government using that SIS system was 1,449. That's 7,515 less. The state also reported 149 less seclusions. Florida would have ranked second in the country for the highest number of restraints if the BESS data had been used, but instead it was 32nd. The GAO found underreporting in many major school districts, which included Florida, and this was confirmed by a report from the Florida Department of Education with the Inspector General in June of 2020 and an OPAGA review. Both found issues with reporting on incidences, including not duplicating reports in both systems, confusion, data system issues in general, and lack of targeted communication. Beyond the issue with the numbers, the data is reported to DOE monthly as required by Florida law, but it's almost impossible to find on their website. The latest reliable information from that BESS system was found in the 2018 annual report from the State Advisory Committee for the Education of Exceptional Students, and nowhere else on the website. The scope of the problem using the data we have shows that there's a major issue with the treatment of children with disabilities, and that the youngest and most vulnerable are experiencing it at the highest levels. When it's factored in that the data is not completely trustworthy, we don't know the true scope and how many Florida children with disabilities have experienced the trauma of seclusion and/or restraint when they're simply supposed to be in school receiving their education.
Now that we know what seclusion and restraint is, let us dive into how this experience impacted these children's lives. My name is Danielle Bromfield, and I will be presenting on how seclusion and restraint leads to various types of childhood trauma. This problem goes well beyond just one behavioral intervention. Before we can understand how seclusion and restraint causes childhood trauma, we have to know what trauma is. A traumatic event is a frightening, dangerous, or violent event that poses a threat to a child's life or bodily integrity. When this occurs between 0 and 17 years old, it's also known as an adverse childhood experience. Both of these definitions come from the National Child Traumatic Stress Network. If restraint puts a child at risk of First, restraint puts a child at risk of physical trauma, otherwise known as bodily harm. As stated before, 8,367 disabled students experienced restraint in the 2017 school year. Although it's against the law, many researchers show that, especially when restraint is used on a child by an untrained staff member, both parties are put at risk of physical trauma. For example, in a high-stress situation, children's airways could be accidentally cut off, and staff members could be kicked by a struggling child. This means that in one school year, 8,000 children were put at risk of bodily injury or death. Both seclusion and restraint could lead to emotional trauma. Emotional trauma can be caused when a child experiences neglect. If you're 6 years old, already experiencing an emotional crisis, being locked in a room against your will for an extended amount of time without the ability to leave, you're experiencing emotional trauma. Studies have shown that the psychological harm caused to students by seclusion and restraint may be so detrimental that some students can develop post-traumatic stress disorder. Finally, children can be re-traumatized. Young people who have experienced trauma in the past are especially at risk of experiencing psychological harm from seclusion and restraint. Seclusion frequently echoes relational trauma, while physical restraint can echo physical or sexual abuse. For example, children with autism spectrum disorder are twice as likely to be sexually abused than their able-bodied counterpart. Additionally, these same children make up a large portion of students who are expected to be physically restrained. For a child who has already experienced sexual abuse, the process of being held face down against your will is a horrific reminder of the sexual trauma they've already experienced. This student is now experiencing psychological harm. Experiencing any form of trauma is bad enough. However, we also know that the impacts of trauma also have serious lifelong consequences on a child's development. In very early development, children with complex trauma histories show deficits in language development and abstract reasoning skills. Later on in elementary school years, children with complex trauma histories may have problems with problem solving, reasoning, and reasoning skills. These consequences to a child's problem-solving and critical skills means not only does seclusion and restraint harm a child, but it also makes it more difficult to navigate emotional crises later on. This is seen in adolescence because many children who experience complex trauma have learning difficulties that may require extra support in the academic environment. Finally, researchers have shown a connection between childhood trauma exposure and chronic illness later on in life. These diseases can range from heart disease to cancer and may even cause an early death. The impact of trauma is significant because negative consequences to a child's life go far beyond just one disciplinary intervention. The trauma impact that we just explained are examples of how trauma impacts otherwise normally developing children. However, if a child already has a learning or cognitive disability, they've already been pushed behind in their development, meaning that secluding and restraining children with disabilities only serves to push them further behind their peers. Seclusion and restraint, therefore, is not a helpful intervention, but rather only compounds the developmental and social impacts of having a disability. For these reasons, many national and Florida organizations have publicly advocated against the use of seclusion and restraint, such as the American Psychiatric Nurse Association and Disability Rights Florida. Countless experts have shown that seclusion and restraint are ineffective because it traumatizes children and only leads them to needing more support later on in their development. With these consequences, it's difficult to understand how we got here and why this form of intervention is still used.
If seclusion and restraint have such clear adverse effects, why were these practices ever permitted? I'm Tiernan Hart, and I'm going to be discussing the legal history of disability leading up to the present day to put seclusion and restraint into perspective as a practice that reflects our history of institutionalization. While there's no precise genesis of seclusion and restraint, the practices are known to come from institutionalization. Restraint itself is known to be tied to psychiatric institutions and asylums going back over at least 100 years. For much of the modern age, disabled people were simply placed in institutions. Subject to a range of inhumane treatment, they were essentially seen as less than human. Eventually, deinstitutionalization occurred in the 1960s through the 70s. In spite of this, today, some children are facing similar traumatic experiences as those that were once in institutions. So the question is, did we change practice, or did we simply change the place that the practices occur? To answer this, we need to follow the evolution of the law. While this series of laws mark the movement away from institutionalization towards education and inclusion, it's important to note that laws granting inclusion in education do not necessarily mean that the children are treated the same. And this is reflected in the fact that seclusion restraint is a persistent problem today. And now our timeline begins just 70 years ago when institutionalization peaked with over 500,000 people placed in psychiatric institutions alone. The first major law on deinstitutionalization was the Rehabilitation Act in 1973, which granted protection from discrimination for disabled persons under U.S. law. Shortly after, the Education for All Handicapped Children Act passed. This piece of legislation serves as a foundation for how disabled children are treated in the education system. All that would follow this is a series of amendments to the EHA, one of which turning it into the IDEA with the addition of the least restrictive environment specification. Again, these laws only addressed education and inclusion. Any sort of possible maltreatment, like seclusion and restraint, was entirely unaddressed under federal requirements. However, in the 112th and 13th congressional sessions, a bill was introduced that would have limited seclusion and restraint if it had passed. The Government Accountability Office, or GAO, began investigating the use of seclusion and restraint in 2009. Shortly after, a number of things happened. As just mentioned, the Keeping All Students Safe Act was proposed, and if it passed, it would have prohibited seclusion, would have prohibited mechanical or chemical restraint, as well as adverse behavioral intervention or any physical restraint that compromises student health and safety. It would have only allowed physical restraint when the student's behavior poses an immediate danger of serious bodily injury to that student or others. In 2012, the Department of Education published a resource document which provided a number of suggestions for how schools ought to use seclusion and restraint. Yet, still, neither of these things guaranteed or they affected any change in treatment. Fast forward to 2019, Secretary of Education Betsy DeVos announced that they would launch an initiative to investigate the possible inappropriate use of restraint and seclusion in our nation's schools by providing technical assistance and support and strengthening enforcement activities. The federal government is also focused on the reporting of data of the state's use of seclusion and restraint. In 2020, there's a GAO report which claims that the nationally reported data was incorrect related to the number of restraints and seclusions. It stated that the Department of Education's quality control processes for the data it collects from public school districts on the instance of restraint and seclusion are largely ineffective or they simply do not exist. This was according to their analysis of the 2015-16 school year, which is the most recently available at the time. Specifically, they said, education's data quality control processes were insufficient to detect problematic data in its civil rights data collection. So the scope of quality control for seclusion and restraint data reporting is rather large and problematic for the national government to hold states accountable. Additionally, there's no federal limitation that seems to be on the horizon. So the change in policy is ultimately going to be left up to the states.
Since the prevention of seclusion and restraint will be left up to the states, what are the best practices for prevention and who is currently implementing them? My name is Caitlin Carroll, and let's look at how some states are leading the way for change and what Florida can do to follow. Between 2016 and 2017, 25 states proposed legislation aimed at reducing the use of seclusion and restraint, and 11 states enacted legislation. Colorado prohibited the use of seclusion and restraint with some exceptions and now requires written reports after any incident. Legislation from multiple states now requires positive behavior intervention training for school staff members, including Maryland, New Mexico, and Tennessee. Some school districts in Florida have also implemented positive behavior intervention training with the PBIS project, but it is currently not required by law. PBIS is a project that provides school districts with the tools to dealing with behavioral issues, particularly in students with disabilities. Their goal is to help staff members intervene before a situation escalates and finding instances where positive behavior can be taught to students to avoid crisis situations. Schools are not required to implement PBIS, but the Individual with Disabilities Education Act strongly urges its implementation. PBIS is a three-tiered model, beginning with Tier 1, which supports all students. Tier 2 focuses on at-risk students who need more targeted group intervention. And Tier 3 provides individualized and intensive support to smaller groups of students. Over 2,000 Florida schools have been trained in Tier 1, but only 27% are trained in Tier 2. PBIS implementation does not mean that everyone in the school has been trained in the system, but even without reaching all staff who interact with students with disabilities, schools that implement PBIS have seen overall improvements in student behavior and are more equipped to reduce seclusion and restraint. You might be wondering, why is PBIS a better way of handling behavioral issues than seclusion and restraint? Seclusion and restraint creates a negative feedback loop that sets students up for failure. A child who has been secluded or restrained once has a much higher chance of experiencing it again, which we know causes childhood trauma and sets back their development. Instead of letting a situation escalate to the point of danger, PBIS aims to prevent these situations from occurring in the first place by taking a more proactive approach. PBIS looks at crisis situations as a pathway with multiple opportunities to teach positive behavior to students. On the other hand, seclusion and restraint is reactive and waits for these problem behaviors to reach a tipping point. School personnel who have been trained in PBIS focus on ways to teach and reward behavior instead of focusing on ways to punish behavior. Data is also utilized more in PBIS to provide insight on how to better support students and prevent crisis situations, instead of data that is only used to document an incident at its surface level. Implementing these strategies from Tier 1 of PBIS gives school districts the opportunity to create a foundation of success for all students, which they can then continue by implementing Tier 2 or Tier 3. Here's one strong example of how PBIS can be used appropriately and effectively. A school district in Florida that self-identified as overusing restraint and seclusion implemented Tier 2 of PBIS and was able to reduce seclusion and restraint by 74% in one school year. They were able to improve the behavior of their students through creating an action plan, which focused on modifying how they were collecting data, setting up training with specific staff members, and making mental health services more available to students. After 1 year of implementation of these preventative strategies, this Florida school district, which discovered that restraint was most often used on students with autism and students in alternative settings, was able to decrease seclusion and restraint by 74%. So imagine how many children could avoid the trauma of seclusion and restraint if all school districts implemented positive behavior intervention. In Florida, Black students with disabilities are more likely to be secluded, mechanically restrained, and physically restrained. To ensure that our schools aren't contributing to the racial disparities that exist in discipline, PBIS has recommendations to adjust positive behavior strategies to be more culturally appropriate for all students. PBIS recommends that any school committed to reducing racial disproportionality in discipline should implement strategies for neutralizing implicit bias, ensure that all students and families feel safe in school, and revise any policies that harm students of color. Positive behavior strategies such as PBIS are working in schools, and there are many states that are implementing best practices, but it is ultimately up to Florida lawmakers to require best practices and positive behavior intervention in our school districts to reduce or eliminate the use of seclusion and restraint.
So it's clear that other states do recognize that seclusion and restraint are harmful and ineffective, and they are trying to move towards best practices. And Florida is not an exception to this. While no legislative changes have actually been made, several pieces of legislation have been proposed throughout the years. My name is Allison Thielen, and today we'll be reviewing those changes and seeing how they align with best practices. So the seclusion and restraint statute was originally created in 2010 and later amended for the last time in 2011 to create the law as it stands today, which brought in the minor restrictions on restraint and seclusion, as well as some reporting and data collection guidelines. And then the first time that we see a bill that would completely ban seclusion and eliminate restraint unless a student is a danger to themselves or others is in 2012. This proposal included a list of definition of terms, training guidelines for school personnel, and introduced the idea of a student-centered follow-up after multiple incidents of restraint. Unfortunately, the bill that made it the farthest died in its second committee of reference, but the effort to ban seclusion and limit restraint does not end here. Identical bills were filed between 2013 and 2016, but none of them made it past their first committee of reference. Then in 2017, a bill that proposed the idea of exclusionary and non-exclusionary time was filed. This bill still banned seclusion, but defined exclusionary time as a period where a student is removed from an environment and placed elsewhere to de-escalate, while non-exclusionary time is more of a period of redirection, allowing the student to remain in the environment. This bill also died before ever being heard in committee. Then in 2018, bills were filed that included exclusionary and non-exclusionary time again, and they made it the farthest than any version of this proposed legislation. However, the final version of this bill died in the last day of session, where it failed to get a final vote. Then in 2019, two proposals were made, one that was identical to the exclusionary and non-exclusionary time bills, and one that went back to the original proposal of completely banning seclusion and limiting restraint, with the addition of establishing clear training requirements for school personnel on PBIS. The exclusionary and non-exclusionary time bill only made it to its second committee of reference in the Senate, while the other bill made it past the House but died in returning messages to the Senate. Then finally, in 2020, bills that banned seclusion and limited restraint were filed with the addition of a pilot program that would have allowed cameras to be placed in special ed classrooms upon a parent's request, which also made it very far along in the process, but the bill that made it the farthest died once it passed in the House, once again. Now, it's important to note that in the 8 years of attempts to amend the original statute, made in 2011, banning seclusion and limiting restraint, regardless of the version of the bill, never received a vote against it. When given the chance, legislators will vote positively on these proposed changes. However, there have been some concerns brought up in committee meetings by the legislature, through personal testimonies, and in the media that may have slowed down their momentum during session. One of the more popular concerns brought up in committee meetings has been the concern for student safety. What if restraint needs to be used to prevent a student from harming others? And while that is a very valid concern, every version of proposed legislation allows restraint in the instance where a student is a danger to themselves or others. The goal of these changes is not to eliminate restraint completely, but to enforce the fact that other methods should be used before restraint is ever used, and that restraint should only be used in emergency situations and not as a punishment or behavior modification, because it just doesn't work that way. Another concern reported mostly in the media is that PBIS strategies are not effective in eliminating problem behavior associated with a child's disability. And the goal with students with disabilities shouldn't be to eliminate problem behavior. That's unrealistic and wrongly places the blame on the student. The goal of PBIS is to reduce the frequency of those behaviors and teach students how to cope with the emotions associated with them. An outburst isn't always an isolated incident, it's often a reaction to triggers common in a school environment, like bright lights, loud noises, and unwanted social interactions. While restraint and seclusion have been proven to escalate those moments of stress, PBIS seeks to de-escalate and prevent those moments from ever reaching a crisis point by equipping teachers and students with the knowledge on potential triggers and positive intervention strategies. So how do these proposed changes align with best practice? Well, banning and seclusion and limiting restraint is absolutely best practice. Seclusion has been proven time and time again to be dangerous and traumatizing, and restraint is really only effective in emergency situations. But when school personnel are not properly trained in restraint methods, or the only option that they know is restraint, it tends to cause more harm than good. Training requirements in PBIS are also best practice, as we discussed earlier, because PBIS training, while it's only one option to reduce restraint, it has been shown to be effective in the Florida schools that already utilize it. As for exclusionary and non-exclusionary time, that would have to be a maybe, because with proper guidelines and restrictions placed on these measures, it could be best practice. Exclusionary time could resemble timeout, which is also only effective with proper training, but even then, students are still removed from an environment and placed elsewhere against their will. And without proper training, the line between exclusionary time and seclusion could become blurred. Cameras in classrooms could also potentially be best practice because it attempts to increase accountability, but we could also do that by fixing our current data transparency issues without infringing on the students' privacy. And as we can see, Florida has not been silent on this issue. Legislators have been trying for years to pass a bill to move us towards best practices. Unfortunately, something always gets in the way, and now we will discuss what could be happening and where we go from here.
So the question remains, why can't Florida pass a bill that would keep our students with disabilities safe from trauma? The numbers show it should have been easy to make this important change and expand protections for Florida students with disabilities. 8 years of proposed legislation show policymakers are willing to stick with this issue. 15 proposed bills from both sides of the aisle show this is not partisan. And there have been 0 votes against these bills, which are based in best practices and research-proven best practice. There doesn't appear to be an explanation why these proposals are not law in our state. The Children's Campaign has reviewed every hearing, public testimony, and debate about the proposed legislation, and there have not been a visible vocal opposition to the bill, or any group speaking with one voice about concerns. The only items of note have been isolated comments that are easily put to rest with education on the issue. We can only surmise that there has to be an effort happening behind the scenes. And the parents of students with disabilities, advocates for Florida's children, and those that want schools to be a safe place for all deserve to know why Florida can't become one of the leaders in addressing the overuse of seclusion and restraint, rather than failing to get to the finish line year after year. So, what should Florida do to protect our students with disabilities? Legislation that would protect students with disabilities while keeping schools safe for everyone would include these recommendations from the Children's Campaign. Prohibit the use of seclusion in Florida public schools. If exclusionary time is allowed, make sure to create clear requirements in statute to ensure it's a positive behavior modification tool rather than another form of seclusion by a different name. Prohibit physical restraint as a behavior modification or punishment. Only allow physical restraint in instances of danger to the student or others, and prohibit all mechanical restraint. These practices are ineffective at changing or eliminating problem behavior. They do not work as appropriate punishment, and they cause trauma, which can lead to long-term emotional and physical damage. We also need to require training in positive behavior intervention for all staff and teachers involved in interaction with students with disabilities, not just lead teachers. We could expand PBIS Tier 2 training for schools across the state and place in statute that the requirement minimal
Seems that Amanda cut out, but I think what she was trying to say at the end was that the reporting requirements should at minimum require reports to be available to the public on an annual basis. And yeah, because Florida students with disabilities deserve to be protected from these practices and provided the support they need to be successful in an educational environment. So we hope that you enjoyed this webinar, and now we're going to open up for questions. If you have anything that we could help you answer, use the chat function found on the bottom toolbar and type your question to the space once the white box pops up. We'll try and get to as many as we can and follow up with any that we can't address. So if anyone has any questions, you can go for it now. So someone asked if there's any proposed legislation on the issue for the 2021 session. And as of right now, we are not sure. We haven't seen anything, but given the trend that this bill continues to pop up every year, it seems most likely that it'll come up again. Someone else brought up that kids are still being restrained under PBIS. So why is it still being recommended? It may be that the schools that have PBIS only have Tier 1, which is very general and includes things like general education through posters in schools on like emotional control and things like that, where Tier 2 kind of addresses those target like at-risk student populations like students with disabilities. And as we learned, not many schools implement Tier 2, which could prevent restraint. but many schools do implement Tier 1, which is more general, so that might be the issue as to why students are still being restrained.
And it also could be the fact that some students will need restraint in some cases in order to keep themselves from being injured or to injure someone else. Like we noted previously, restraint cannot be completely ruled out simply because at some times they have to be protected from themselves or others just to ensure safety for everyone in school. I see some questions about finding out if PBIS is taught in schools. And what we'll do is when we respond with the link to the recording for this webinar to everybody who's on the webinar here, we will provide the link to the PBIS website, which will give you direct information about where PBIS is being implemented. What ends up happening is that you can see across the line who got trained, and it at least would show you the start of whether or not your school or your school district was trained in PBIS. And I think we have time for one more. I can also get you the information about the school district. I think I can get you the information about the school district that's self-reported that was overusing restraint or seclusion. It was actually in the PBIS annual report where they were looking at places that it had worked appropriately across the state. I don't know if they gave us that information, but I think we could at least tell you which were the tier 2 options that were being utilized across the state. So it may be able to at least narrow it down. I'm not sure if they specified the exact district. I think that's the end of our time because we were at 11:45. So I want to thank everyone who attended and learned more about seclusion and restraint in Florida. As I mentioned earlier, we're going to follow up with an email that will provide you the link to this recording and also answer any of the questions that we couldn't get to due to time restraints or any of the places that we needed to give you some more information. So if you wanted to continue to type your questions, we can help get to them when we respond back after doing the webinar. Again, thanks so much for attending, and we appreciate your participation.